Alcohol, friend or foe? You've probably been exposed to it in college or at a party. And I know when I was a kid growing up, it wasn't a big deal. So when I turned 21, people said, "Oh, you can drink." I was like, "Ah." But the reason I'm actually bringing this up, this is Dr. Gold with Dr. Gold's Optimal Living Institute. I have many patients who just didn't know their risk for breast cancer can be elevated. We know breast cancer is the most common cancer in women, and there's been many deaths just in the last year, 774,000 deaths related to alcohol associated with cancers, namely breast cancer in particular for the women, even in women drinking low doses. So I'm going to speak on one of my patients, Mary, who came to see me not too long ago, a 53-year-old woman, telling me that she has family history of breast cancer, wants to keep her risk low, but she does drink to get a buzz, a few drinks, mainly socially on the weekends, and didn't realize that even just 3 drinks at one time, once a week, can increase her risk by 15% for breast cancer. The way it works is alcohol breaks down to acetaldehyde, which is a toxin, and that toxin is a known carcinogen in the body. And it also, what alcohol does is raises estrogen levels, and they think it might be from aromatization, where there's a conversion in fat cells. And we know as we get older, sometimes we get a little more fatty tissue, but it can convert the, as women, we also have testosterone, the testosterone to estrogen. And this can happen in males as well. And that's why sometimes we see males forming breast-like tissue. They also have that belly, and they just can get very teary-eyed. They're feminizing a little bit. So really important, and men can get breast cancer as well, even though it's a lower risk, a lower percentage. But the idea is we need to pay attention that alcohol is not as benign as we thought. And I have some people, one of my patients got out of rehab. He's been working hard, but just it's been challenging with COVID, dealing with all these effects. So you need to take a step back, breathe, and recognize that the amount does matter. And if you do want to drink here and there are first some non-alcoholic choices like kefir or kombucha, some mocktails, so you can get non-alcoholic type beverages, which are still really yummy, but without the alcohol, without its detrimental effects, especially if it affects you. So alcohol can decrease your REM sleep. So that means your deep sleep is affected, and I know some people use it for sleep in particular, but over the long haul, it can diminish good sleep. It also can be toxic to the liver, so meaning you're not detoxifying or cleaning out other chemicals that are getting exposed in your body. So we think of the liver as a cleaner or a filter, and if it can't do its job because it is because it's a fatty liver, or just because it is swollen, or the machinery is not working like it should, then we can see that those detrimental effects where reactive oxidative species, or ROS, go up, and then our ability to fight it, it overloads our antioxidant levels, the glutathione or superoxide dismutase, which are kind of key players to helping our body fight infections. So know that you can get better. It takes guidance. So if you are feeling that alcohol is a must for you in your life, that's kind of a red flag. If you can go without alcohol for long periods of time, that's a good sign. But if you need it, you're getting hangovers, you had a DUI, you're searching for it, you're finding on your way home, you're picking up a beer on a regular, consistent basis, you're gaining lots of weight from it because it is calories, even wine. All that is sugar, more calories. I know they have the low alcohol types. Now that said, if you have alcohol here and there, maybe once a year or a few times a year, just at parties or just small amounts, and you're not having any deleterious effects, no heartburn, no weight gain effects, good mental cognition, good sleep, good energy, because all that can be affected by alcohol, where you feel fatigued, tired, and sluggish. So I'm here to share with you just that your body can heal, you can get stronger, and if you need some help, I'm happy to see you. We can see each other virtually or in person. You just contact me via message. And I'm Dr. Gold, again, with Dr. Gold's Optimal Living Institute. Live your optimal life. You deserve that. Take care now.